everyone, welcome back to my channel Mind the Gap. I am Jayati और सबसे पहले तो I want to apologize for not being active on social media and not making videos because of personal and health reasons. I was not able to be active on social media. For all the people who messaged me, emailed me, thank you so much. To the best of my ability, I've tried to respond to everybody from my end. But अगर कोई बच गया है, please don't hesitate to write back to me. You all have been on my mind and I've been thinking about what our next topic of conversation can be on mental health. May is Mental Health Awareness Month and I thought that it would be a good idea to talk about some myths around mental health, around therapy, around therapists, and some frequently asked questions about mental health that I have come across as a mental health professional, that people have asked me in the therapy room, outside the therapy room, my friends, my family, people who I've met. So let's get started. I think सबसे पहला जो myth है वो है that therapy is for mental disorders only, और therapy पे तो वो लोग जाते हैं पागल होते हैं, people who are crazy. It's a place for crazy people. Firstly, I'm not fond of that word, and secondly, थेरेपी या एक साइकोलॉजिस्ट या एक काउंसलर के पास कोई भी जा सकता है. At some point in our lives, all of our mental health gets affected in some way or the other. Therapy एक space है जहाँ पे जाके you make sense of what is happening in your life, you give language to it, you build capacities to deal with that problem. तो जैसे जब हम फिजिकली कभी बीमार होते हैं तो हम डॉक्टर के पास छोटी मोटी बीमारी के लिए भी तो जाते हैं ना, कि एक एक्सपर्ट पर्सपेक्टिव मिल जाएगा, बीमारी जल्दी ठीक हो जाएगी. द सेम वे अ थेरेपिस्ट इज ऑल्सो एन एक्सपर्ट हु इज learned, who has studied for years about mental health, about the human mind, about behavior, about society, about how a personality is built and how our personality interacts with the environment, with the society. So it's many years of studying and training, after which a therapist, and at least an ethical one, is sitting with you in the therapy room. और वो कोई भी problem हो सकती है. It doesn't have to be a problem that is catastrophic, एक problem जिसकी जो solve नहीं हुई तो उससे life end हो जाएगी. Second myth, and I think one of my most favorite myths, is therapy जाके दिमाग और खराब हो जाता है. जो थेरेपी जाते हैं उनके दिमाग में अतरंगी आइडियाज आ जाते हैं, वो बहुत चेंज हो जाते हैं. See, therapy is a commitment. It's not easy to go to a stranger and open up about your most vulnerable parts, most emotional parts, जो हमने शायद कभी किसी के साथ भी डिस्कस नहीं करे और शायद आपको खुद भी नहीं पता. A lot of times when people come to therapy, when people go to therapy, we actually discover some things about ourselves which even we didn't know. एंड येस, जब आप थेरेपी में जाते हैं तो कुछ हमारे इमोशंस ओपन अप होते हैं, कुछ थॉट्स हैं जो ओपन अप होते हैं, जो हम डिस्कस करते हैं थेरेपी में, जिसकी वजह से फॉर सम टाइम यू माइट फील दैट यू नो योर इमोशंस आर गोइंग हेवायर, आपका ग्राफ बहुत ऊपर नीचे जा रहा है. और हम अज्यूम क्या कर लेते हैं, अगर कोई बाय चांस थेरेपी जा रहा है एंड दे आर गोइंग थ्रू सम इमोशंस, and you know they're not themselves at some point in the day, or you know some days when they're feeling low because of something, हम assume क्या करते हैं कि because this person is going for therapy, देखो उनको ये feel हो रहा है. Therapy does not create issues. At least in the beginning, many parts of therapy is actually about you realizing all the thoughts and emotions that are already in you. जो therapy बस बाहर ले आता है, बस surface पे ले आता है. And therapy just brings them to light, just brings perspective, so that long term में हम उस problem के साथ deal करना सीख जाएं, rather than being crippled by it, or you know worse, not addressing it at all. And yes, long-term therapy does bring about some transformations in the personality. We're meeting at least every week and showing up for ourselves and discussing some very deep-seated emotions, some parts of our personality that are very vulnerable. And it's only natural that over time, as we discuss, हमारी personality में change आएगा, the way we look at ourselves would change, the way we look at the world would change over time. पर कई बार क्या होता है, जो आसपास के लोग होते हैं उनके लिए ये change बहुत कंफ्यूजिंग होता है एक्सेप्ट करना, बिकॉज दे आर नॉट गोइंग थ्रू द प्रोसेस. द पर्सन हु इज गोइंग टू थेरेपी, उनको पता है कि उनका प्रोसेस कैसा चल रहा है, व्हाट दे आर फीलिंग, स्पेशली इन अ कलेक्टिविस्टिक सोसाइटी लाइक आवर्स, जहाँ पर बाउंड्रीज बहुत ब्लर्ड होती है. मैंने इसके बारे में पहले भी बात करी हुई है, जहाँ पे हम एक दूसरे की लाइफ में बहुत क्लोजली इन्वॉल्व होते हैं. अगर हम जरा सा भी चेंज होते हैं तो आसपास के लोगों को फटाफट एक तो वो पिक कर लेते हैं, और उनको बहुत प्रॉब्लम होने लगती है. व्हाई द पर्सन इज चेंजिंग, व्हाट हैज हैपेंड, एंड द चेंज बिकम्स difficult not just for the person who is going for therapy but also for people around. पर कोई इंसान अगर चेंज हो जाता है, इवन इफ इट इज इम्पोर्टेंट फॉर दैट पर्सन टू चेंज इन दैट वे, अगर किसी इंसान को बिल्कुल गुस्सा नहीं आता है, वो कोई अच्छी बात नहीं है. अगर वो हल्का सा अपने लिए स्टार्ट स्टैंडिंग अप फॉर देमसेल्व्स, तो उसको नेगेटिवली लिया जाता है. थेरेपी बस आपको ओपन अप कर देती है सो दैट यू आर एबल टू एक्सप्लोर योरसेल्फ फुल्ली, यू आर एबल टू लिव मोर फुल्ली. And don't get me wrong, it doesn't mean that we go around और हम चिल्लाने लग जाए दूसरे लोगों पे, और हम गुस्सा करने लग जाए unnecessarily on the pretext that I'm working on myself. But अपने बारे में सोच पाना, अपने आप को ध्यान में रखना, along with keeping the other person in mind, वो important होता है. The third myth is therapy is for those who don't have people to talk to. Friends and family are not substitutes to therapy. You can have friends, you can have the most loving family, you can have a lot of social support, you can have a very active social life, and yet choose to go to a mental health professional. There would be some things that you're going through that other people around you might not have a solution for. They might not be able to help you with it, and an expert can. It doesn't mean that you have no resources at all. It simply means that you need additional resources to make sense of something in your life. The fourth myth is therapists सिर्फ बातें करने के पैसे लेते हैं, या therapists take money and do nothing. When a person comes to a therapist, the work is not just of the 50 minutes, 1 hour जितनी भी देर का session है. The work also goes before and after. A therapist keeps their patients in mind. There's a lot of work that goes into preparing session notes, preparing what could be discussed in the session, preparing goals for the session, thinking about how therapy could help them, and even after the session we carry the session in our mind. अगर हमें लगता है कि कहीं हमें कुछ प्रॉब्लम आ रही है, ethically an empathetic ethical therapist, we're supposed to have supervisors who we take the session to. We discuss the session, we discuss the person, of course, in complete confidentiality, without discussing any demographic details, without leaking any kind of confidential information that might, might reveal the identity of the person. But we discuss things that the person might be going through and how therapy could help them. So it's an ongoing work. Therapists use their feelings and emotions in the therapy room to understand what the person is going through. जब हम as a therapist therapy में बैठते हैं, तो ऐसा नहीं है that we are a clean slate, we are a blank slate, and we have no thoughts, no emotions, almost robotic. If we were to be like that, therapy would never be effective. Another part of being a therapist is to go for your own therapy. So it is recommended for a therapist that they go for their own therapy, not just so that they know how it is to be a patient, but also to open up their own feelings or emotions. अगर मैं अपने emotions, अपनी feelings as a therapist पहचानना, accept करना, उनको work through करना, वो नहीं कर पाऊंगी, तो how would I make space for the other person's feelings and emotions who's coming to me? I would feel a burnout, I'll feel a saturation very quickly. So, for example, a person is coming to me and they feel that nobody would be able to take their emotions. And if I have myself not worked through emotions, my own emotions myself, I'm only perpetuating that other person's problem. क्योंकि वो अपनी problem मुझे बताएंगे और मैं फिर से overwhelm हो जाऊंगी. तो उनका जो idea है that nobody can take my problems, वो और strong हो जाएगा. So I'm perpetuating the other person's problem. And for that, I need to constantly be working on myself. So a therapist does not just take money for those 50 minutes, 1 hour. There's a lot of work that goes before and after the session. And of course, just like any other profession, therapists are also paying the bills with the session fees, right? There's no denying that. But at the same time, there's a genuine attempt to help the person who's come to them for therapy and make sense of their problems alongside and help them cope with it better. The fifth myth is, if you start therapy, you have to be in it forever. Therapy का तो कोई end नहीं है. It doesn't end, it continues. A quote here from one of my favorite mental health professionals. He was a psychoanalyst, D.W. Winnicott, and I'll read that quote out for you. It says, "We all hope our patients will finish with us and forget us, and that they will find living itself to be the therapy that makes sense." Ethical practitioners are really driven to do meaningful work and are really invested in the work that they do. ज़रूरी नहीं है कि थेरेपी लेने से प्रॉब्लम्स फिनिश हो गई, अब मैं क्योर हो जाऊंगी, अब कोई प्रॉब्लम नहीं आएगी. फॉर एग्जाम्पल, you come to therapy and you because of therapy you're able to get out of a very difficult relationship that you were in. Doesn't mean necessarily that you'll never get into a relationship again. Doesn't necessarily mean a breakup will not happen again. All of that would happen. Therapy is not there to eradicate the problems per se. It's there so that you're able to make sense of the problem, you're able to build capacities to deal with that problem. Terminating therapy is always a mutual decision between the therapist and the patient, and of course, at the end, it is obviously the patient's decision, right? They are coming to therapy and they have full liberty to stop therapy as well. Therapists are like facilitators only. But see, there's another side to it, right? And there's no denying it, that being an ethical therapist is a difficult task. A person who's coming to therapy is bringing their most vulnerable parts to therapy. They're paying a high amount for it, no doubt about it. As an ethical therapist, it's my duty to also let go of it, let go of the fees, let go of the person, because they have really healed and they've moved on and they're ready to be in the world without therapy. Now, the therapist has to work on themselves enough that they feel connected to the patient. They recognize the progress that therapy is making for the patient, and also let go of the patient when the time has come. The duration of therapy, how many sessions, how long, all of that is mutually decided between the therapist and the patient. It does not mean that you have to be in therapy forever, but there are different ways how people look at therapy, right? Some people feel that there is this problem that they have to resolve, and once they feel comfortable with it, they leave therapy. There are other people who come to therapy, realize that the problem they came with has been resolved, but there are other things that have opened up that they want to explore, so the therapy goes for longer. There are some other people who see therapy as any other doctor that they would go to. So अगर हम regular checkups के लिए एक डॉक्टर के पास जाते हैं, वैसे ही some people make therapy part of their lives. So the next time you think of going to therapy, make sure to give yourself and the therapist a few sessions to see if you're feeling comfortable going to therapy, if you're feeling comfortable with the person that you're going to, if you're able to open up to them, if the other person in front of you is ethical. Ask them about their education, ask them about their experience, their professional experience, ask them about if they have experience in working with the problem that you're coming to therapy with. Ask them if they think that they'll be able to work with you, and the same goes for you. Ask yourself if you'll be able to work with this therapist. I hope you found this video helpful. Please let me know what you thought of the video below. If you don't want to write in the comments below, you can also write to me on email. The email is in the description below. Next video में हम थोड़े से और myths के बारे में बात करेंगे. For example, therapy is just advice giving, or therapy is not for everyone. Or my favorite, therapists खुद ही पागल होते हैं. So we'll talk about some of these myths in the Mental Health Awareness Month. I'll see you next time. Till then, take care and bye-bye.